Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? Hey, this is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time. And folks, this is episode 250. This is a real milestone for me. When we first started doing this show 3 years ago, in 2018, it's been a little bit over 3 years in the making, I never thought that we would ever exceed even 100 episodes, let alone 250. We're a quarter of 1,000 episodes, and I believe that with the ever-changing information that's always coming to us any given week, any given month, any given year, as the Medicare program continues to expand and things do change, and we do have news to bring you and information that's going to be helpful in helping you make a good and informed decision with your Medicare. I don't see why we can't get to 1,000 episodes, and who knows, we might even start doing more than one episode a week once again. For any of you who have been listening to this show since the beginning, you know that we at one point did 3 episodes a week for a very long time. It just was just too much of a strain on me, and we had to cut back, but who knows, maybe we can up it to 2 a week in the near future. We'll have to see kind of what happens. But folks, so today's episode that I wanted to talk to you about is some more examples as to why you don't want to work with an out-of-state call center. I'm not trying to pick on out-of-state call centers. I know that there are several that are very good at what they do, but I encountered a situation with one of my own clients in the last few weeks that I wanted to share with you. This is a person that was referred to us, okay? Her brother has had a Medicare plan with us, lives here in Utah. And we work with people all over the country, so just to be transparent about that. But her brother has worked with us for some time, has had a Medicare Advantage plan with us here in Utah for some time, and she was turning 65, and she had enrolled with an out-of-state call center. So her brother strongly encouraged her to get a second opinion with me, and she did just that. So we got on a Zoom call together, and She sounded like she had talked to a lot of different people, but every single person she had spoken to was in a call center somewhere. She had called Joe Namath, right? She had called Mike Ditka. She had called Joe Theismann. She had called all of these different TV commercials, and she never really actually spoke with, in my opinion, a real insurance agent, a real independent insurance agent. Not that insurance agents and call centers aren't real, but they're not probably as proficient in terms of what they're actually looking at, especially when they're looking at Medicare Advantage plans, than an independent insurance agent will, especially one that's got any kind of experience. So I looked at what plan she was recommended, and there were 3 things that stuck out to me. So she was recommended a very popular plan with a very large insurance company. Now, the plan that she's recommended is very popular in many states in the country, and it's kind of one of their flagship plans. However, that particular plan here in Utah, where she lives, and it just so happens that she is here in Utah where I am. We work with people all over the country, like I said. But that particular plan is popular all over the place, but here in Utah, it's not very competitive whatsoever. And I'll tell you why. When you're dealing with a Medicare Advantage plan, and more call centers are trying to sling Medicare Advantage plans, whether they're a good fit for somebody or not. Sometimes they are, sometimes they're not. You really have to look at it with an unbiased lens, right? An unbiased perspective. But essentially, a Medicare Advantage plan is a combination of a lot of different variables, a lot of different working parts, right? You have networks involved. You have to make sure that your providers are in the network, right? There's a prescription plan that's built into it in most cases. You have to make sure that the plan covers your prescriptions and covers them well. There's also benefits involved like dental, vision, hearing, medical benefits. You want to make sure that you enroll into one that has a very low out-of-pocket, low copays if you can help it. And if you want to try to find the best mixture of all of those things wrapped into one neat little package. So the plan she enrolled into is not very competitive here whatsoever. And the reason for that, and like I said, in other parts of the country, it's very competitive. So I know exactly what the game these call center agents are playing is, especially, and call center agents too, you got to keep in mind, folks, most call centers, especially these really, really, really big ones, they cycle through people like a meat grinder. So chances are the person you're talking to on the other end of the phone has 6 months or less of experience. That would scare the hell out of me, personally. I want to work with someone that has 6 years of experience, or 16, not 6 months or less. And the issue with this particular plan for this individual was it has the smallest provider network in Utah by a mile. It does not cover any of the largest hospital systems. They told her that her doctors would be covered. Upon checking, none of her doctors were covered. And it was just a terrible fit for her in multiple instances. That's just one example. So why did they recommend this plan? Can't they see what I see? Well, yes. But one thing you have to understand that when you're dealing with a call center organization, most call centers are taking calls from all 50 states. What do we know about Medicare Advantage plans? The benefits are going to vary in all 50 states. And in some states that are large states like a Florida, a California, a Texas, the plans are going to be different in one part of the state than they will be 200 miles east, right? Or 200 miles north, or just 200 miles in another direction within the same state. Another area in the state might have completely different benefits. So these call center representatives, they're essentially receiving calls from all different places, right? The last 5 calls, for all we know, before this call center representative received the call from this lady from Utah, they might have talked to someone in Florida, in Miami, might have talked to someone in Houston right before that, someone in New York City right before that, someone in Chicago right before that, someone in Denver right before that. Like, they're taking calls all over the country. And so there are some plans that they see over and over and over again. And they see the plan, they recognize the plan, they don't know anything about the market. They're typing in the zip code for the first time when they get that person on the phone. But they see a plan they're familiar with, they're like, oh, that plan must be good. And they're just kind of guessing. The plan that they picked for her is a very popular plan nationwide. In this state, it's trash. Point blank. And for this lady, it was a terrible fit. I literally could have, randomly picked a plan out of a hat and picked a better plan for her specifically. It was bad on her drugs, didn't cover any of her doctors. It was just a bad fit all the way around. And the plan is not very popular here, like I said, for those reasons. The network ends up being an issue. The network ends up being a challenge for a lot of people. Now, upon further evaluation of her situation, I came to find out that she had a very expensive injection that she gets every 2 months at the doctor's office. Now, for those of you who don't know, injections in the Medicare world are not covered under prescription drug coverage. They're going to be covered under medical coverage. For Medicare Advantage plans, most Medicare Advantage plans in the country, not all, but most, are going to cover these injections at 20%. They actually call it Medicare Part B drugs. Medicare Part B drugs are medical costs, medical drugs. It's essentially infusions, injections, something that you get done in a doctor's office that you can't take on your own. So she had one of these that she did every 2 months. Upon further research, it was about $8,000. And any Medicare Advantage plan in our market would charge her 20% coinsurance up to the max out-of-pocket. Her particular plan had a $6,000 max out-of-pocket. She would have hit her max out-of-pocket easily. So not only did they put her on a bad Advantage plan for her situation, one that didn't fit her needs, but they didn't even mention to her the possibility of a Medicare supplement. We were able to put her on a Plan G, $130 a month premium with a one-time a year deductible of $203, and that is all that she's going to have to pay out of pocket for this infusion. So instead of paying $6,000 in medical bills, she pays $130 a month in premium, and the first time she gets it done, it'll be a $200 bill, $203 bill with the Plan G. This is something I was able to figure out in 45 minutes to an hour with her. And she just was, once we actually started to uncover things and peel back the layers and pull back the curtains, she was horrified at the mistake she almost made. Her plan was set to go into effect August 1st. For those of you who don't know, when you turn 65 and you select a plan, in most situations, especially in the Medicare Advantage world, once your plan goes into effect on the first of your 65th birth month, you cannot change it in most cases unless you qualify for a special enrollment period. But if you don't, you might potentially end up stuck on it until open enrollment. And she would have been out in the cold in multiple different ways. So I've said it before, I'll say it again. You want to be ever so careful, especially when you're working with an out-of-state call center representative. You'll never be able to get that person back on the phone in most instances. It's so much better to work with an independent insurance agency. It doesn't even have to be one in your market, but one that knows your market well enough. This is what I encourage you to do. My company works with people in 40 states. We don't enter a state until we understand it and understand the market. So if you need help with your Medicare, if we can help you out, if you find yourself in the same situation, or you think you might be in the same situation, or you're afraid you might be, or you just want to make sure you're not in the same situation as this lovely lady was, call my office today. Our office number is 801-255-5340, 801-255-5340. We're licensed in 40 states. Chances are we can help you. And I hope you folks understand what I'm explaining to you. I hope that you really heed my warning and just work with an independent insurance agency or insurance broker. It's going to do you well, even if it's not us. However, I do believe that we bring some of the best support, some of the best knowledge, some of the best understanding, some of the best customer service in the entire industry. But take this episode as a warning. Heed this warning. This could have ended up very badly for her. Thankfully, we were able to do a reconsideration of her plan and review of her plan, and we found all of these issues and all these errors. But it was this close to being a disaster and being one of those stories you hear about where someone couldn't see their doctors on a Medicare Advantage plan, which is what gives Medicare Advantage plans a bad name. Now, in this particular situation, she needed to go with Medicare Supplement, but it just makes Medicare Advantage plans look bad because the proper due diligence was not placed when selecting it. Anyway, folks, thanks so much for watching. I hope you enjoyed this episode. Every single Monday, we bring you a podcast episode where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. Subscribe on YouTube if you're watching on YouTube. Drop a like on this video. Drop us a 5-star review on Apple Podcasts and any other platform you're listening to us on that allows you to do so. And we'll see you next time. Happy Medicaring.